RadCare itself is comprised of a little over 100 full-time radiologists, and that's full-time equivalents. And we span about 35 to 40 states. You know, we're essentially a full-service professional radiology firm, and we have a national footprint. And when I say full service, what we want to do is provide a radiology service where we're providing both the on-site services as well as the off-site services under a single accountable component. Whereas the old paradigm may have been for a local group or even a regional group to cover all of the on-site radiology needs, the overnight piece has always been or traditionally been subcontracted to a third party, a Nighthawk, if you will. You usually lose some amount of control and accountability when you do that. There's always a disconnect between the actual on-site group and the off-site group. So you've got a lot of finger pointing. Well, whose responsibility is it ultimately to have and to perform at the same level during the overnight hours as you do during the daytime hours? So oftentimes the hospital itself will subcontract for that service. Sometimes the radiology group will subcontract for it. But there's always this disconnect. There's always a different level of quality overnight compared to the daytime hours. So what our strategy is to provide continuity of service 24/7. In the past, the paradigm has always been to take a core of physicians and dedicate them to a single facility for the off-site services, simply because they needed to have a dedicated system to access that facility. All right. So you weren't able to use your full complement of resources. You were limited in the connectivity and access to your different clients. That was the single most limiting factor. So really, in a very, very simple way, what the Super PAC system has been able to do is it resides on top of all of our different PAC systems among all of our client facilities, and it connects all of our resources. If we can connect all of our physicians to the majority of our client platforms, then we can smartly and efficiently direct and fill that capacity. That's really what it is.